I'm Dr. Ryan DeBell from The Movement Fix. This is Movement Fix Monday, and today we're going to look at something a little bit more clinical. I'm going to take a peek at neck pain, and I'm going to show you one classification of neck pain, which is the person who is hypermobile in sort of the middle of their neck. And a lot of times what can happen with people is that, I'll show you an example here on the spine. So if this person was sitting here, and I was checking their neck range of motion, what I want to know for that person is, are all the joints of their neck contributing to the global range of motion? And so when I test someone's neck range of motion, I have them tilt side to side, look down, look up, rotate both directions. And what happens a lot of time for a lot of people, either because of habit or previous history of injury, is they will develop an area of their neck where they move too much through. And so when I ask them to bend their head to the side or look up or look down, I'll find this area where, say in the middle of their neck right here, they hinge right there, or they hinge up here, and they don't have contribution from all the joints. Because when we look at neck range of motion, I'm thinking that from T4, which is roughly right here, is sort of functionally where the neck begins in terms of looking around. And so you will see this if you check neck range of motion, is that people a lot of times will hinge. If they look up, they may hinge just in the middle of their neck rather than getting some contribution from the upper back. The consequence of that is when someone has one joint or two or three joints where they primarily move through and they don't get contribution from other joints, they get a overuse injury at those joints that are moving too much. And so a lot of times for that athlete, they need to learn how to use their neck as a larger functional unit, getting contribution from multiple joints. And so I have a little bit of a case study for you today, and I'm going to use my wife, who gave me permission, someone who's had chronic neck pain, and we're going to take a look at what that actually looks like, and then some ways and some methods that we can look at to how can we help that person get the load distributed over more joints rather than focused on just one or two, where the hypermobility occurs and where we can get pain and other issues going on. So let's take a look at what that looks like. So I have Alana here, and she has volunteered her neck for me to show you some things about what may be going on with her. And so one of the things I noticed when checking her neck range of motion was the way in which she bent to the side. And so can you show, like, if I had you bend your head to the right, can you show us how you would do it? Okay, and then look straight forward, and now tilt your head to the left. Now what you can see in Alana is that, go ahead and relax, there is a lot of tilting that's happening from the middle of her neck. And one of the ways that you can see whether or not that's the case is this. I said before that functionally the neck starts from like the fourth bone or the fourth joint down in the thoracic spine. And so if I tell Alana, I'm going to put my finger right here down basically between the tops of her shoulder blade more or less, and I'm going to say, what I want you to do is tilt your head to the left, but think about letting it relax all the way from down here. And rather than sort of tilting like this, think about tilting from all the way down here. And go ahead and do that for me. And you can see how different of a range of motion that appears for her. Now go the other way. Let's see what that looks like. Good, okay? And now do it the way that you wanted to do it the first time. And so you can see how there's just so much more contribution occurring in the middle of the neck versus the way when I tell her to do it from down lower in the middle or the thoracic spine. There's more contribution from some of those other joints. What she has to learn to do as an athlete, or even just as a human being with a neck, is that she has to learn how to make it more of a habit to use the joints that are lower down to help contribute to the global pattern of neck movement. Sometimes it's as easy as literally just practicing bending to the side from all the way down here. So go ahead and just show us a couple reps. So sometimes it's as simple as just learning how to do it and then doing it enough so that it feels normal. Sometimes though, we have to load it. And we have to create some sort of demand on other areas of the body so the neck can learn how to do that when there is some sort of external load. And so what we can do for that is, Alana's going to swing around here. We have a band attached to the rack here, and she's going to pull it into her chest, and there's just going to be a little bit of tension on it, and she's going to push it away from her body about 4 or 5 inches. Now what that does is it loads some of the muscles in the trunk. And once that's loaded, what we will then do in this position is start trying to bend the neck from down lower where we were doing it seated and doing reps there. So go ahead and just do a couple reps. And it's really, really important that the person realize that they can let all the way down here help in this movement. And go ahead and do the other direction. And so once once we do a certain amount of reps here, maybe 5, 10, 15 reps, we could switch around so that the band is pulling in the opposite direction. But for demo purposes, I just want to show you the one side. Now here's the thing. The way that you move your body feels normal to you, even if it's not technically correct, because your habit feels normal, of course. And so the first time that we did this, and I had Alana move her neck from lower down, she goes, "This feels wrong, this feels awkward." And it does feel awkward when you learn how to move a different way if it's not your habit. And it's going to take some retraining. It's going to take a lot of reps because there's probably been thousands and thousands of reps over time where she's done that, and that's her habit. And we have to change that, and we have to make the new way feel more normal. But what that does is it makes some of the range of motion that was happening in the middle of the neck be distributed over more joints, and so there's less stress at one or two particular joints within the neck. So that's kind of where we're working on, or what we're working on and what we're looking at. And so it's important to both do it just seated, and also sometimes you have to add in that load with the band. Now here's the thing. Neck pain can be complicated. If you have neck pain, don't assume that this is necessarily the reason why you have neck pain. This is one reason a person can have neck pain. It's one thing to look at. It's one thing to add into your exam if you're a healthcare provider that maybe you haven't thought about before, or maybe you've never seen kind of implementation of getting some contribution from the joints lower in the neck or upper back like that. So if you do have neck pain out there, don't assume that this is why. Just know that it is possibly one reason why. But you should always get evaluated if you have neck pain, so don't rely on just this video if you have neck pain. You should go get evaluated, but realize that this is something that's out there. There can be these hinge points in the spine where there's this big amount of stress rather than being distributed over the whole load. So that's Movement Fix Monday for this week. Hey, if you haven't already followed us on Facebook, go to facebook.com/The Movement Fix. Follow us on Instagram at The Movement Fix. And the new t-shirt, the new Movement Fix t-shirt, which I have under here, but I'm not going to show it to you today, but it's on the Open 15.4 video. It'll be on the website ready for pre-sale or pre-order on Wednesday at 5 p.m. at themovementfix.com. I'm only going to pre-sale 100 of them at the special price of $15, and then it'll go up to the regular price once they are actually in stock. So make sure you're one of those first 100 if you want one. They're awesome, so check it out. I'll see you guys for 15.5 this Thursday. And then we'll see what we got going on for that last event in the Open. Good luck, and take care. See you guys later.